12 weird signs that show you're having stomach damage. The stomach, a remarkable organ that orchestrates the intricate process of digestion, plays a pivotal role in our overall health and well-being. Its complex functions break down food into absorbable nutrients, ensuring our bodies receive the sustenance they need to function optimally. Yet, despite its remarkable efficiency, the stomach is not impervious to damage from various factors, including unhealthy lifestyle choices, underlying medical conditions, and infections. When the stomach sustains damage, its digestive processes are disrupted, leading to a range of symptoms and potential nutritional deficiencies. Therefore, safeguarding the health of our stomachs is essential for maintaining overall well-being. Today, we'll delve into 12 unusual signs that might indicate stomach damage. These signs, often overlooked or misattributed to other causes, serve as important clues that something is amiss with your stomach's health. By recognizing these signs and seeking timely medical attention, you can take proactive steps to protect your stomach and prevent further damage. 1. Weight loss. Losing weight unexpectedly, even if you're not trying to, might be a sign of stomach damage. When your stomach isn't working properly, it can affect how well you digest food, absorb nutrients, and maintain a healthy weight. This can lead to a gradual loss of weight, even if you're eating the same amount or even more than you usually do. There are several reasons why unexplained weight loss can be a sign of stomach damage. Inflammatory bowel disease, IBD, which includes conditions like Crohn's disease and ulcerative colitis, is one example. These conditions cause chronic inflammation in the digestive tract, which can damage the lining of the stomach and small intestine. This damage can interfere with nutrient absorption, leading to weight loss. Another cause of unexplained weight loss due to stomach damage is gastroparesis, a condition in which the muscles in the stomach don't contract properly, causing food to move slowly through the digestive tract. This can lead to bloating, nausea, vomiting, and ultimately, weight loss. 2. Persistent digestive discomfort. Persistent digestive discomfort is another weird sign that could indicate underlying stomach damage. If you find yourself constantly experiencing issues such as bloating, gas, indigestion, or discomfort after meals, it may be a red flag for potential stomach problems. Stomach damage can disrupt the normal digestive processes, leading to a range of discomforting symptoms. Conditions like gastritis, which is inflammation of the stomach lining often caused by factors like H. pylori infection, can contribute to persistent digestive issues. The inflammation may result in pain or discomfort in the upper abdomen, along with feelings of fullness even when you haven't eaten much. Furthermore, conditions like peptic ulcers, which are sores that develop on the inner lining of the stomach, can cause persistent discomfort. The pain associated with peptic ulcers is usually felt in the upper abdomen and may be aggravated by eating. 3. Unexplained nausea and vomiting. Experiencing unexplained nausea and vomiting can be a puzzling and uncomfortable symptom that may signal underlying stomach damage. While occasional nausea and vomiting can be attributed to various factors, persistent and unexplained episodes warrant attention. Stomach damage, such as inflammation of the stomach lining, gastritis, or conditions like gastroparesis, can disrupt the normal digestive process, leading to feelings of nausea. Gastroparesis, in particular, is a condition where the stomach muscles don't contract properly, causing delayed emptying and potentially resulting in nausea and vomiting. Additionally, conditions like peptic ulcers or infections like H. pylori can irritate the stomach lining, triggering nausea as a response to the inflammation. Unexplained nausea and vomiting may also be associated with other gastrointestinal issues, such as acid reflux, or even more serious conditions like stomach cancer. 4. Difficulty swallowing. Difficulty swallowing, also known as dysphagia, is a peculiar symptom that may indicate stomach damage or issues within the digestive tract. While occasional difficulty swallowing can be attributed to minor causes like dryness or nervousness, persistent challenges in swallowing should not be overlooked. Stomach damage can contribute to difficulty swallowing through various mechanisms. For instance, conditions like gastroesophageal reflux disease can cause stomach acid to flow back into the esophagus, leading to irritation and inflammation. This inflammation, if severe, can result in the narrowing of the esophagus, making it more challenging to swallow. Furthermore, The presence of peptic ulcers or tumors in the stomach or esophagus can obstruct the normal passage of food, causing discomfort and difficulty in swallowing. Inflammatory conditions, such as esophagitis, can also contribute to this symptom. If you find yourself constantly experiencing difficulty swallowing, especially if it's accompanied by pain or a sensation of food getting stuck in your throat, it's imperative to consult with a healthcare professional promptly. 5. Heartburn or acid reflux. Experiencing unexplained heartburn or acid reflux on a regular basis can be more than just an inconvenience. It could be a signal of potential stomach damage. Heartburn occurs when stomach acid backs up into the tube that carries food from the mouth to the stomach, known as the esophagus. This backward flow, often referred to as acid reflux, can lead to a burning sensation in the chest and throat. Stomach damage, particularly conditions like gastroesophageal reflux disease (GERD), is a common culprit behind persistent heartburn. In GERD, the lower esophageal sphincter, a muscular ring that acts as a valve between the esophagus and stomach, weakens or malfunctions. This allows stomach acid to flow back into the esophagus, causing irritation and the characteristic burning sensation. Moreover, stomach ulcers, which are sores that develop on the inner lining of the stomach, can contribute to acid reflux. The presence of Helicobacter pylori bacteria, a common cause of stomach ulcers, may exacerbate acid reflux symptoms. If you're frequently experiencing unexplained heartburn or acid reflux, especially if it's disrupting your daily life or sleep, seeking medical advice is crucial. Chronic acid reflux can lead to complications such as Barrett's esophagus, a condition that increases the risk of esophageal cancer. 6. Abdominal pain. Persistent and unexplained abdominal pain is a noteworthy sign that may point to potential stomach damage or underlying gastrointestinal issues. The abdomen houses various organs, including the stomach, and pain in this region can be a manifestation of several conditions. Stomach damage can contribute to abdominal pain through various mechanisms. Inflammatory conditions such as gastritis, which involves inflammation of the stomach lining, can lead to discomfort or pain in the upper abdomen. Peptic ulcers, open sores that develop on the inner lining of the stomach, are another possible cause of abdominal pain. These ulcers can be aggravated by factors like H. pylori infection or the use of nonsteroidal anti-inflammatory drugs. Inflammatory bowel diseases (IBD), such as Crohn's disease or ulcerative colitis, are also associated with abdominal pain. These conditions involve chronic inflammation of the digestive tract and can cause discomfort, cramping, and pain. 7. Fatigue. Experiencing unexplained fatigue can be a subtle yet significant sign that may indicate potential stomach damage or underlying gastrointestinal issues. While fatigue is a common symptom with various possible causes, persistent and unexplained tiredness should not be ignored. Stomach damage can contribute to fatigue through several mechanisms. When the stomach is not functioning optimally, it can impact the absorption of essential nutrients, such as iron and vitamin B12. Deficiencies in these nutrients, in particular, are known to cause fatigue. Conditions like celiac disease, which is an autoimmune disorder characterized by an intolerance to gluten, can lead to damage in the small intestine. This damage can impair nutrient absorption and result in fatigue. Inflammatory bowel diseases, like Crohn's disease and ulcerative colitis, can also contribute to fatigue due to chronic inflammation and malabsorption of nutrients. Additionally, chronic gastrointestinal bleeding, often associated with conditions like peptic ulcers, can lead to anemia, characterized by a reduced number of red blood cells. Anemia can result in fatigue as the body struggles to transport sufficient oxygen to tissues and organs. 8. Changes in bowel habits. Noticing unexplained changes in bowel habits can be a significant indicator of potential stomach damage or underlying gastrointestinal issues. Your bowel habits, including the frequency, consistency, and color of your stools, can provide valuable insights into your digestive health. Stomach damage can lead to alterations in bowel habits through various mechanisms. Conditions like inflammatory bowel disease, which encompasses conditions like Crohn's disease and ulcerative colitis, can cause chronic inflammation in the digestive tract, leading to changes in stool patterns. This may include diarrhea, constipation, or fluctuations between the two. Moreover, conditions such as irritable bowel syndrome can contribute to changes in bowel habits, including abdominal pain, bloating, and alterations in stool consistency. Infections, such as those caused by bacteria or parasites, can also lead to diarrhea or other changes in bowel movements. 9. Changes in appetite. Experiencing unexplained changes in appetite can be a notable signal that something may be amiss with your digestive system, potentially indicating stomach damage or underlying gastrointestinal issues. Your appetite, which refers to the desire to eat, can be influenced by various factors, and persistent alterations may warrant attention. Stomach damage can impact appetite through different mechanisms. Conditions like gastritis or peptic ulcers, which involve inflammation of the stomach lining, can lead to discomfort or pain, potentially causing a decrease in appetite. On the other hand, certain gastrointestinal disorders, such as overactive thyroid or conditions affecting the hypothalamus, can lead to an increased appetite. Inflammatory bowel diseases, such as Crohn's disease and ulcerative colitis, can also influence appetite. Chronic inflammation in the digestive tract may result in feelings of fullness or discomfort, contributing to changes in eating habits. 10. Bad breath. Experiencing unexplained bad breath, also known as halitosis, can be a surprising yet relevant sign that may point to potential stomach damage or underlying gastrointestinal issues. While bad breath can often be attributed to oral hygiene or diet, persistent and unexplained halitosis may have connections to your digestive health. Stomach damage can contribute to bad breath through various pathways. Conditions like gastroesophageal reflux disease can lead to the regurgitation of stomach contents, including stomach acid, into the esophagus and even the mouth. This regurgitation can result in an acidic taste and odor, contributing to bad breath. Additionally, infections such as Helicobacter pylori in the stomach can cause inflammation of the stomach lining, gastritis. The resulting increase in stomach acid production and the release of odorous compounds can contribute to unpleasant breath. Unexplained bad breath may also be associated with other gastrointestinal issues like inflammatory bowel diseases or malabsorption disorders, where the body struggles to absorb nutrients properly. These conditions can lead to changes in the composition of gut bacteria, potentially influencing breath odor. 11. Early satiety. Experiencing early satiety, or feeling full after consuming only a small amount of food, can be a peculiar sign that may indicate potential stomach damage or underlying gastrointestinal issues. While factors like stress or rapid eating can contribute to a sense of fullness, persistent and unexplained early satiety warrants attention. Stomach damage can contribute to early satiety through various mechanisms. Conditions such as gastroparesis, where the stomach muscles don't contract properly, can delay the emptying of food from the stomach to the small intestine. This delay can result in feelings of fullness, bloating, and discomfort even after consuming a small portion of food. Inflammatory conditions like gastritis or peptic ulcers can also cause early satiety. Inflammation of the stomach lining can lead to discomfort or pain, making it challenging to consume a regular-sized meal. Gastrointestinal cancers, including stomach cancer, can also be associated with early satiety. Tumors or other abnormalities in the stomach may reduce its capacity, causing a sensation of fullness with minimal food intake. 12. Belching. Experiencing unexplained belching, or excessive burping, can be an intriguing sign that may indicate potential stomach damage or underlying gastrointestinal issues. While occasional belching is a natural and common occurrence, persistent and unexplained belching may be linked to your digestive health. Stomach damage can contribute to increased belching through various avenues. Conditions such as gastroesophageal reflux disease can lead to the regurgitation of stomach acid into the esophagus, causing irritation and prompting belching as a natural response to release excess air. Helicobacter pylori infection, a common bacterial infection that can affect the stomach lining, may also contribute to excessive belching. The presence of H. pylori can lead to increased production of stomach acid, resulting in belching as a way for the body to release built-up gas. Inflammation of the stomach lining, gastritis, caused by various factors, including infection or the use of NSAIDs, can also contribute to belching. Additionally, conditions affecting the motility of the stomach muscles, such as gastroparesis, may result in the accumulation of gas and subsequent belching. If you're facing any of these 12 weird signs, it's important to talk to a doctor. They can find out what's causing it and help you get the right care. Taking care of stomach problems early can make you happier and, most important, keep you healthier. And now I encourage you to share your experiences and thoughts in the comments below. Have you ever experienced these signs before? If so, how have they affected your health? I hope you enjoyed this video. Please like, subscribe, and hit the notification bell for more health-related videos. Thank you for watching.